Yeah, perfect. All right, welcome everyone to today's webinar, Rejuvenating Consumer Leadership, Lessons from the Updated Consumer Advisory Board Manual. I am Catherine Cavanaugh, the Consumer Advocate with the National Healthcare for the Homeless Council, and I will be moderating today's webinar presented by the Council with support from the Health Resources and Services Administration. This session will be recorded. It's going to be a 6-minute presentation with the last 15 minutes reserved for questions and answers. There is a chat box on the side of the presentation for any participant questions or technical issues. Please type your questions or issues into the chat box at any time during the presentation. If you have a question or a story you'd like to tell related to what the consumers are talking about, please feel free to use the chat box liberally so we can hear what you guys are all experiencing. Please type the questions in that you have so we can answer during the question and answer section at the end. If we're not able to make it through all of your questions during this time, we'll log all of the questions and our presenters will respond with a written response after the webinar has ended. If you're having any technical issues with what you're hearing or seeing, you can call the Council's office at 615-226-2292 for some technical assistance. The presentation and the recording of this webinar will be posted on our website within 3 business days. And so, as for now, I would like to introduce a little bit what we're going to talk about. Today we will be unveiling the Consumer Advisory Board Manual Update. You'll be hearing from 3 members of our National Consumer Advisory Board on this topic. NCAB co-chair David Peery from Camillus Health Center, regional representative for Regions 3 and 4, Elving, Caraballo, and then Keith Belton, who's a regional representative for Regions 5 and 7, will be here to share lessons. All of them helped work on this update and are excited to finally share the lessons with you guys. Just to acknowledge a little bit about what we're going to do, we're going to spend the next hour together, so we want to create some agreements about how we spend our time together. Just wanting to ask people to please respect everybody's personal opinions and experiences. Ask questions if you're confused about things. We want to make sure this is as interactive and engaging as possible. We don't want people leaving unsure about what was said. If you're confused about anything that our presenters talk about, please let us know. Ask some questions. And then also assume positive intent while acknowledging impact. If anybody says anything that's hurtful or offensive to you, we want to make sure that this is a space where we can acknowledge those hard feelings. So please, if something comes across in a way that is hurtful to you, please acknowledge it. Let us know what is feeling so we can acknowledge what's happening in this space. But also remember, hopefully with positive intent, no one here is intending any malice. We're all trying to create a common space of dignity for all. And so assuming that if anything it comes off hurtful, that it is just some of our bias or kind of lack of emotions that we're not processing at this moment. But hopefully we can acknowledge how people are feeling. Along those lines, we want to encourage it to be a brave space. I know a lot of people are familiar with talking about safe spaces. We want to make sure that this is a safe space for people to feel like they can be open about who they are and what they've experienced, but brave enough to really speak the hard truths. We don't want people to shy away from any hard truths, especially in our consumer engagement work. We know there's a lot of difficult topics around power dynamics and marginalized populations and representation. So there's a lot of hard topics we have to talk about if we're going to do this work authentically and do it well. So we wanted to make this a brave space where we can talk about these hard topics in a way that's respectful for everyone. So a little bit about how we got here at this moment that we're at today. So our National Consumer Advisory Board was formed in 2003. This is a group of 15 individuals with the lived experience of homelessness who work on a number of issues to try and uplift the consumer voice on a national perspective. One of their main projects is making sure that consumers are represented in governance at health centers. And so when they initially formed, one of the first projects that they took on was developing out a Consumer Advisory Board manual, guidance from them on how to run a CAB. And so their very first, the initial CAB manual was in 2003. That was written by the NCAB with support from council staff and Boston Healthcare for the Homeless helped Ellen put that together on the initial draft. And then in 2009, there was another update that was done. This was taken on by the NCAB as a whole at the time, so the consumer advocate at the time, and NCAB really took an in-depth look at the consumer board manual and beefed it up quite a bit to include the lessons from other CABs and other experiences. And that was the last time the manual has been updated, was in 2009. So NCAB was really looking at this a few years ago as we kept hearing that there was some other lessons people wanted to hear about. They wanted sample documents and wanted to know more about how to form a CAB and specific issues around conflict management. We've got a lot of TA requests around issues on how to run an effective CAB, and so NCAB wanted to create an update to this manual just to include the decade of learning that they have all gone through. So about 2 years ago, NCAB decided to take on an update for the Consumer Advisory Board Manual as one of their big projects, and they wanted to give them 2 years in order to really do the work intentionally, that they wanted to do it in an inclusive way and an effective way. So their goals when they started out this project was to look at the 2009 iteration of the Consumer Advisory Board Manual and make that information more accessible, revising some of the language. NCAB has recently adopted a principle of making sure all of our language is people first. And so we wanted to make sure that the Consumer Advisory Manual had similar people-first language, so we wanted to revise some of the language and make the information more accessible to folks, more understandable, and then wanting to provide more samples. So that was something we heard from a lot of people, was wanting samples of operating guidelines or agendas and how minutes are run. And so this is, NCAB really wanted to provide more samples to make the Consumer Advisory Board Manual really useful for folks. So that was some of their initial goals going in. So they developed out a 2-year process to get that done. They started initially with a review and a survey of the manual. So NCAB, all of the steering committee members, went through the edition of the manual and looked at what are things that they liked, what was working, what wasn't working, what needed to be changed. And also, so the steering committee members really went in depth looking at the current version of the manual. We also held a national survey asking for general consumers' experiences with the manual and things that should be added. And then we took all of that feedback together and then looked at developing out a new format for the Consumer Advisory Board Manual. From the feedback we got from NCAB, it was just clear that we really wanted 3 sections to the manual. We wanted to include some of the beefed up content sections in the beginning to really focus on delineating some of the lessons in the CAB manual. So wanting to have more focused content sections so people could get to the information they were specifically looking for. And then wanting to have a second section that was focused on the sample documents so we could compile a bunch of samples and beef up that section. And then the third section was newly created to form a workbook. So this would be for new CABs who were starting to really work through the questions of what you would need to think about as you're starting a CAB. What are the different questions you could work through? So CABs can then really take the lessons that are in the content section and then look at the sample documents and then use the workbook to really determine what's right for your CAB, your community, and your organization, because the intent of this manual is to provide lessons and best practices from NCAB, but we also know that every community, every organization is different, and that one-size-fits-all solution isn't going to work, but wanting to provide some of those questions so each CAB could really do this work on their own as well. So once they determined this new format, NCAB split all into teams, and the teams then drafted all of these new sections, coming up with the content sections and editing that from our previous CAB manual. We solicited sample documents from CABs across the U.S., and then we had a team that looked at all of the different samples and decided which ones they wanted to be included in the manual. And then we had a team that looked at all of the content sections and worked through what would be the corresponding questions a CAB would need to think about in order to form their CAB, to form the workbook. And so the teams then drafted these individual sections, and then all of the sections were sent out to NCAB to review as a whole. And then we held monthly, I think it was actually 2 months, we held office hours. It was 2 hours every Friday where NCAB members were open to call in, and we would just talk through the different sections and edits that we had. So people were allowed to kind of, as they were reading through the manual, come to those office hours with questions or edits that they saw themselves. And we also had a set agenda of like things, outstanding questions we had about edits in the manual that we worked through. And so those NCAB office hours were how we kind of did the final editing to push it all together. And so I am very happy to announce and unveil for the first time, we do have the updated CAB manual for public consumption. Yay! 2 years into making, so excited to just get this in the field so you guys can see it. It's in the resources pod at the bottom of your screen. You'll see CAB manual. This is the final version of their updated manual where you can see all of these sections and all the lessons yourself. So please liberally open the resource and share it with as many people as you want. We're really hoping that this updated version can provide important guidance for the field. And so I will pass it on to our wonderful NCAB members to talk about the manual itself. So I'll pass it first to David Peery to tell us what a CAB is.
Okay, thank you, Catherine. I'm David Peery. I'm one of the 2 co-chairs of the National Consumer Advisory Board. And before I get into what is a CAB, I just want to just capitalize on what Catherine just said here, that this is a collection of best practices coming from NCAB members from all over the nation. It's a 2-year labor of love, and I emphasize those 2 words, labor and love. This was an incredible amount of work, but it really was an amazing team effort, brought together from folks from California, Oregon, Illinois, Texas, and Florida, Massachusetts, as well as other places. So we put a lot of work into this, and as I said, it's a collection of national best practices, which is really a starting point for CABs from all over the nation can follow, and also for folks that wish to form a CAB. So let's talk about what is a CAB. On the next slide here, talks about the importance of the consumer voice. So basically, there's a federal requirement that the 51% of the majority of governing board of health centers must be composed of a population of persons that they serve. So for the type of healthcare clinics that we're concerned with, which are healthcare for the homeless clinics that primarily serve the homeless population, that means that 51% of the board of directors of its governing board should be composed of persons who have experienced homelessness. But it's not always possible to meet that requirement. So what the federal law does is it builds in an ability to get a waiver of that 51% requirement. And the best way, and you can also accomplish this waiver through a variety of means, either by having focus groups, perhaps, or conducting periodic surveys. But we believe that the best way to waive this 51% requirement is by forming a consumer advisory board, a CAB. So what is a CAB? A CAB basically is a group of consumers of health center services who meet on a regular basis to give advice, recommendations, and feedback to clinic's management and to its board of directors. CABs, as I said, are typically required under that federal waiver. The majority of the health center's governing board be composed of the consumers that it serves. So on this slide that you see here, the importance of the consumer voice, there is obviously a practical importance to that. So it begs the question, why are CABs the most effective way to implement the consumer voice? First, they help to improve service delivery. It's a well-established principle of any organization or any business that the best way to understand your customers is by hearing what they have to say. And so that's what CABs do. They provide a forum to allow health centers to connect with the consumers that they serve. They allow for feedback. They allow for advice and recommendations to the health center's management and to its board of directors. They provide for outreach for the clinic to actually provide reach out to the individuals that it has not yet served to bring them into the clinic's field of service. In this way, they improve the health center's services, and they can provide for more effective and efficient service delivery. Now, on the right side of that slide, Importance of the Consumer Voice, Practical, you'll see screenshots of certain pages from the new updated Consumer Advisory Board manual. So, again, I encourage everyone to please download this manual and take a look at these pages that we are now being provided to you through these photographs. So on the next slide, we then talk about CAB activities. Now, aside from providing a forum, CABs can and should sponsor activities that will help in outreach and help in publicizing clinics' operations, and that will also help in pulling in consumers to provide an effective forum to give advice and feedback to the clinic's management and to its board of directors. Engaging in activities is also a powerful tool to publicize the CAB itself and publicize the health center itself. It can build the CAB up and helps in CAB recruiting and helps in CAB membership. Because really, as you'll find from other speakers later on, that's really one of the biggest challenges of running a CAB, is maintaining its membership and maintaining and building up its membership and recruiting. So, essentially, the best and most effective way to build your CAB and to promote your health center is by sponsoring and hosting activities. Now, basically, there's two types of activities, national activities and local activities. One of the oldest national activities has been our Homeless Persons Memorial Day. What is Homeless Persons Memorial Day? That's an annual commemoration, an annual Memorial Day that's held near or at the winter solstice, which is the longest night of the year, at which we commemorate those individuals who lived on the streets who have passed away during the previous year. So why do we hold this on the longest night of the year? That's because that is powerful symbolism. The nighttime is the most vulnerable time for persons who are experiencing homelessness. That's the time that you're most vulnerable to theft, violence, and loss of your possessions. It's the scariest night. It's also, conversely, from a contradictory fashion, the time when you're least likely to have a really good night's sleep, because of those vulnerabilities. So starting, I believe, about 20 years ago or so, we've held National Homeless Persons Memorial Day. And that's where CABs can most often find themselves able to conduct an activity and to publicize their health center's activities by holding Homeless Persons Memorial Day activities. We also have recently been promoting summer solstice celebrations. Summer solstice celebrations are the counterpart to Homeless Persons Memorial Day. That is generally held, actually it would be this week under normal circumstances. That's generally held during the time of the longest day, the time of the year of the most light. And that is also symbolism for the light and success in all of our lives. So lately, NCAB has been promoting summer solstice celebrations as a way to celebrate the success and the light in each of our lives. On those days, CABs can hold activities that celebrate individual members or consumer success in obtaining housing, in connecting with health care, or perhaps success of the health center staff in providing services to consumers. There's a variety of ways that you can put on a summer solstice celebration. But any way that you do it, again, will promote the CAB and will promote the health center and help to build up the CAB and will help in terms of outreach of the health center. Another national activity is Healthcare for the Homeless Day, and that's often done in conjunction with the National Association of Health Centers. It's a day that's generally held, I believe, either the first or the second Wednesday in August. It's called National Healthcare for the Homeless Day. And on that day, the National Healthcare for the National Health Center Association will sponsor activities to promote health centers. usually on that day, many health centers will hold health fairs and screenings and things like that. So cabs can actually assist their health centers in health fairs. Now, local activities are extremely important. Aside from these three national activities, local activities are the way that you truly can build up your cab and that you can help to give your individual cab members leadership opportunities. So you can hold what's known as Meet the Cab events, for instance. And that's something that we really, really pushed here in Miami. A Meet the Cab event is simply something where you might set up a table and you put it in your health center or perhaps at your affiliated shelter. And you have everybody gather around the table, or your cab members gather around your table, and you can have brochures and you can have other publications that describe your health center services and also describe your cab and what your cab does. So this is a way that the public and other consumers who don't know much about your health center or about the cab can actually, quote-unquote, meet the cab. Local activities can also include health fairs and health screenings. And this is something that we've done periodically in conjunction with our health center here in Miami. We have put on periodic blood pressure and glucose screenings. So the cab's role in this is first to publicize the screening, and on the date of the screening, we actually assist in the logistics. We help to maintain the lines, and we help to give out goodie bags, and we just help to answer questions that people may have in terms of where the health center may be located, the hours, and assist the health center in making appointments. Another activity, which is actually rather important these days and has logistical problems, I think, with the COVID pandemic, is voter registration. That is extremely important. That actually arises from the national, I think they call it the motor voter law that was passed in the 1990s, that encourages all nonprofits to engage in voter registration. So even though this maybe ostensibly on its surface doesn't appear to be connected, with the actual health mission of a cab or the health mission of a health center, that is actually not the case. It is intimately connected with being a nonprofit and with being a nonprofit that receives government and federal funds. So voter registration, we believe, is an extremely important activity that cabs can engage in. And the way that we advise folks to do it during this COVID pandemic is to look at your own states, individual states, processes and requirements for mail-in voting and mail-in registration. Some states actually encourage and have online registration. So this is a way that you can educate your consumers on how to get registered. And we would encourage everyone listening to this webinar to contact us through Catherine Kavanaugh, and we can send you more information on how you can educate your consumers on voting by mail or registering by mail, and how you can promote voter registration activities even during this COVID pandemic. So I just want to emphasize here that CAB activities are extremely important. And there is a whole array of activities, both national and local, that you can get engaged in. And especially on the local activities, that is a powerful, powerful way to build your CAB up, to start your CAB, to build it up, to conduct outreach, to publicize the health center, to publicize the CAB, and to register voters. So on that note, I am going to now turn, one more slide here on CAB membership. Let's talk about the eligibility to sit on the CAB. CABs should primarily or perhaps exclusively be composed of the actual consumers of a health center services. In other words, a CAB can best give advice on the facility services if the CAB members are the ones who are actually receiving the services. But depending upon your local circumstances, cabs may also find it beneficial to include members of the community on their cab, even if these members don't actually receive services. For instance, Boston's Healthcare for the Homeless cab, I believe, often includes non-consumer healthcare professionals as voting members due to a large percentage of health professionals and public health researchers in the Boston area. Again, this is something for local cabs to decide what is best for them. Whichever way you go, it's pretty obvious that the majority of your membership should be composed of the actual consumers of services in order to best effectuate your mission of giving advice and recommendations to health center management. Now, as your cab grows, you can have different classes of cab members. For instance, non-voting members versus voting members. And the slide lists 3 different types of members. You can have associate members, you can have ambassadors, and that may be more of verbiage distinction than actual distinction. Here in Miami, we have 2 classes of members. We have our regular cab voting members, and then we have ambassadors who are non-voting cab members. They'll get our cab T-shirt. They'll have pretty much all the rights of being a regular cab member, except that they just don't vote on the important issues that we send up to management. And the reason why we have these ambassadors is because we're limited in the number of voting members that we can have. And so when a voting membership slot actually opens up, then we fill it with the next available ambassador. So again, I'm now going to go ahead and turn the podium over to Elving Caraballo, who is going to talk about how to develop a cab.
Okay, thank you, Mr. Peery. And good afternoon to you all. My name is Elving Caraballo, and I am the representative of District 3 and 4 of our National Consumer Advisory Board Steering Committee. I will start with chapter number 5 and the CAB meetings. CAB business is generally conducted through monthly meetings. NCAB encourages all cabs to offer food and beverages to meeting attendees as encouragement to attend meetings. We find that folks come for the food, but they stay for the meeting. So when you're preparing for the meeting, you establish the purpose and the desired outcome of the meetings. Assign someone to create and distribute an agenda for each meeting, because each agenda item may require a different type of action label. Items indicate what action is expected. The operating guidelines should identify who is responsible for the agenda. Many cabs choose the chairperson and cab support staff to develop the agenda. In each meeting, you must assign someone to record the minutes, working closely with the health center staff to make sure that the minutes are shared with the governing board and those who attend the meeting. For the meeting, it's important that you keep all CAB members informed by keeping the minutes available. How will be easier for them to receive the minutes, whether it's email, letter in the mail, or posting the minutes in the health center. Now, for every meeting, we all know that we have general guidelines that we must follow. So the guidelines that would assume here, we'll be having, you hold your meetings at least once a quarter. Most cabs hold their meetings monthly, which is what we do down here in Miami. Start and end all meetings on time. The CAB chairperson should run the meeting by following the agenda and ensuring the CAB is making consensus decisions. Encourage public participation by all members following the meeting rules, the rules for the meeting. Remain unbiased when voting. Come to a consensus decision. Realize that the meetings are a reflection of how well your CAB operates. We're going to go to the meeting minutes. The minutes from each monthly meeting should be given to the health center's liaison within 2 days. The minutes must be accurate and informative that can be clearly read and understood by the CAB. Following, we're going to go to the meeting's group agreements. When holding any meeting, it is helpful to establish ground rules for those people will demonstrate respect and allow everyone to participate fully. Okay, wait a minute. I got the... Okay, general guidelines. General guidelines. Hold your meetings at least once. Okay, mostly, okay, we're going to this. Group agreements, okay, respect fully. Okay, CAB business is generally conducted through monthly meetings. NCAB encourage all CABs. No, wait. NCAB. Agreement meetings. Okay, wait. Okay. In the NCAB, the group meetings, there are group meetings, the agreements. There will be no crosstalks. Silence all the phones. Leave the room to speak on the phone. Step up, step back. Once you have contributed to the conservation, give space for others to share. Respect personal experience and opinions. Welcome respectful disagreements. The public meetings, in summary. It is important that CAB meetings always be open to the public. CAB can fulfill their mission of giving advice and feedback to the center's management and governing board by encouraging discussion among all stakeholders, including guests, community members, and non-voting members. Public CAB meetings ensure a high quality of CAB decisions and recommendations. The trust, the transparency, and inclusiveness of public meetings shows everyone how your CAB operates and encourages others to want to join your CAB membership. That concludes the end of chapter number 5. Okay, moving on to CAB operating guidelines or bylaws. That'll be section 8. CABs should develop their own guidelines and bylaws to explain how the CAB is structured and establish guidelines the CAB functioning. Each CAB decides on their specific operating guidelines as a group, but they should define the name and purpose of the CAB, define membership, including the process for becoming a member, the duties of membership, and how to remove a member. Establish officer positions and responsibilities. Outline how often meetings will be required and what committees will be developed to support the work. Establish decision-making process, including refining the relationship with the organization and who makes what decisions. Explain the code of conduct, which outlines the expectations for CAB member participation in meetings and in the community. The development of operation guidelines and bylaws is crucial. Guidelines should be short and to the point. There are general guidelines. How your meetings are at least once. No, wait a minute. Okay. On to the point. Okay. You should also remember that they're not written in cement. They can be amended and probably should be reviewed on an annual basis. All operating guidelines or bylaws must establish rules within the perimeters of your organization's federal waiver for the 51% Consumer Governing Board. Officers. Officers are responsible for maintaining the work and focus of the group. Establishing these positions helps ensure that the CAB members are leading the work rather than having staff management lead the group, manage the group. Common officer positions. You have the chair. This person is responsible for helping to set the agenda, facilitate the meeting, ensure everyone has the support they need to engage, and ensure the work of the CAB is being completed. So you have the co-chair. Co-chairs, having one person responsible is often overwhelming, so we recommend having at least one co-chair to support the chair. Secretary, he takes the notes or the minutes of the meeting. You also have unique positions. We have vibes watchers. Keeps an eye on the emotional climate of the groups. And this de-escalates the group when encounters get high, when emotions get high. An outreach conditioner, outreach coordinator, distribute recruitment flyers. Okay, we have the committees. Committees can help empower all members to become leaders in special activities and projects. The purpose is to bring in more consumers to support the work and focus talents of the individual members. Okay, we have several ideas of how many committees you could have. You could have a recruitment committee, select promotional materials, including flyers, and plan events to recruit new CAB members. You could have fundraising, plan activities or events to raise funds to support CAB activities. Example, t-shirts, events, education opportunities. The outreach, provide emotional and material support for folks on the street and connecting to the health center. Social media, promote, monitor, and administrate the social media presence of the CAB. You should also remember that they're not bringing this man. No, wait. Oh, no, number 5, you have education. It's another committee that you could have for your CAB. Is the education. Educate the community about the importance of homelessness on health and work with clinical staff to educate consumers about health issues that impact them. Advocacy. Promote and champion issues that are important to ending homelessness and expanding access to the health care. And that will conclude the end of the operating guidelines or Section 8. Now we'll move to Section 9, decision making. There are 2 types of decision making. There are 2 types of decision-making processes that CABs can use during their meetings. During the meeting, do you have consensus decision-making or majority rules? First, the consensus model. Consensus emphasizes thinking about what is best for the organization and aims to find a proposal acceptable enough that all members can support it, and no member opposes it. The focus is respectfully sharing and incorporating views of the individual members to foster unity of purposes. Consensus is not a unanimous vote. A consensus decision might not represent every member's first priority. Consensus is based on compromise and the ability to find common ground. Consensus requires time, active participation of all members, communication skills such as listening, conflict resolution, and discussion, facilitation, and creative thinking, and open-mindedness. Listening is the most important element of the consensus process. Avoid preconceived expectations of what other participants will say or what they mean. Speak briefly and clearly. Keep remarks to the subject at hand. Speak to the body as a whole rather than to individual participants. Take responsibility for making your opinions known. Do not take offense if others disagree with you. Each member brings diversity in temperament, background, education, and experience, and has unique contributions to make. Keep the goals of the organization in mind. Consensus is a process that works creatively to include all persons making the decisions. There's a process for the consensus, and we're going to go through the process.
Elving?
Ma'am?
Yeah, we might want to switch over to the relationship with the organization, and just to save some time, folks can look at the process to go through the different models in the CAB manual, but just want to make sure we have enough time if we want to move to the relationship with the health center.
Okay, we're going to do that. We're going to do that. Okay, I got it. You want to go with the health center or the governing board?
Yeah, you can go over both. I would just, maybe if you can do it in just a couple minutes so we can still have enough time for Keith.
Okay, the CAB relationship with the governing board. Through participation on the center's governing board, CAB members can give the governing board the unique perspective of people with lived experience and homelessness, as well as advising the governing board on the health center policies and services from the laws of consumer, from the consumer. It is important to understand that CAB members who sit on the health center governing board are co-equal peers with the other board members and perform special functions by offering the perspective of consumers. Always keep in mind that your participation on the governing board is not only a legal requirement of many health center waivers, but that your perspective of a consumer who is or has experienced homelessness is unique and valuable to the board and makes good business sense. Do not be afraid to speak up about important issues and ask other members to clarify or explain matters that are confusing. Having one or more consumer members on the governing board or the governing board will assist the CAB in at least two ways. Provide direct feedback to the governing board on center policies and services, and demonstrate the importance of consumer leadership throughout the health center. If there are issues between the health center management and the CAB, the governing board can be placed first for the CAB to address those concerns. In a recommendation, it is made to management and it is not acted on. The staff liaison should always report back to the CAB within an explanation of why the recommendation was not acted on. NCAB National Consumer Advisory Board strongly recommends that the CABs seek to meet privately with the center CEO or executive director to resolve any differences between before presenting it to the governing board. NCAB feels that this is that it should be carefully considered, rarely used, and reserved for only important issues, depending upon its relationship with management. A CAB may never have to use this mechanism. Okay, relationship with management. The relationship between CAB and center management is crucial. There are many resources a CAB needs to be successful. What it should work with organizational staff to address. One of the functional needs is support in organizing meetings, which includes having a place to hold the meetings, someone to take the minutes and to distribute them, and someone to send out reminders about the upcoming meetings. We have found beneficial to hold the meeting at the same place on the same day and all the same each month. In some health centers, executive directors, CEOs regularly attend the monthly CAB meetings to hear from the CAB, provide a monthly report on services or upcoming changes, and or report back on issues. The NCAB encourages the attendance of the CEOs or executive director, as such attendance shows that the voice of the consumers prioritized and valued by the leadership team. NCAB recommends that another senior member of the center leadership attends CAB meetings with the CEO or the executive director cannot attend the meeting. It's good practice for CABs to invite clinicians and administrators from within the health center to make a presentation to the CAB on what they do. It is an easy way for the CAB to become acquainted with the different parts of the organization, and it allows the staff to become acquainted with the CAB. We cannot stress enough that the CAB is an advisory group, and members do not make decisions or staff issues on day-to-day operations, but rather makes recommendations and suggestions on issues that affect the consumers they represent. And that concludes my report. I could pass it now to Mr. Keith. Can I pass it over to Mr. Keith, please?
Yeah, absolutely. Keith?
He's probably on mute.
Thank everyone. Sorry about that. Thank everyone for showing up. And I'm going to read CRAP for 5 and 7. I'm going to talk about the CAB members and CAB members role, which is, I'm talking about CAB members role, which is Section 7. CAB members role include will respond to the interests of all people serviced by the organizations that will not use the organization may not use the organization on the CAB for their own personal advocacy or for their individual advocacy or mental or support. I will focus on the elect. I really can't. Can you open it up a little bit more, Catherine? Hello?
No.
You can't? Okay. I got it. I'm sorry. Anyway, where I was at, the effort of maintaining the accuracy and role by present goal. I can't really see it because it ain't open all the way. Trying to open it some more so I can see it. So I'm just going to talk CAB members, how CAB members have no special authority within the health center. CABs are community leaders and role models. So what I'm going to talk about today, I'm going to talk about CABs have, people that's in the CAB have no special place in the health center. They are strictly volunteers, and what their place is to help the clinic make decisions on basis of the health center, and to work with the health center on making it better for the consumers that come to the clinic. And also the community leaders, they are role models. You know, they are role models to the community. They are role models to the voice of the CABs, the voice of the consumers in the clinics, and they should act as such. They should work as a team to actually get things done, and they actually should work with the staff and other members of the clinic to work with one another. So, okay, maintaining a CAB. CAB maintainer must work together and act as a team. The group should maintain focus on the consumer and the health center best interests. Together, they should make decisions working with one another, helping one another, and not cross-talk with one another. They should pay more attention to what the focus of their team member, or the focus of that CAB is, and the focus of what one another is working on. They should maintain. They should maintain with the health center in the best interest of the health center to move forward in the things above. That's about it. I'll pass it over to Catherine.
Yeah, so thank you. Yeah, I know we kind of ran out of time here on questions, but I think that works out because I don't see any questions in the chat box at this time. So I'll just reiterate again, my name is Catherine Cavanaugh. I'm the consumer advocate with the National Healthcare for the Homeless Council. So with that, I staff the National Consumer Advisory Board, but I also provide support and technical assistance to organizations on the ground looking to engage consumers in their work. So please download the CAB manual here in the resources pod, and as you're looking through it, if you have any questions about the content that you're reading, please reach out to me. My contact information is here on the screen. Reach out with any questions about how to set it up, or if you want any technical assistance, any support in applying these lessons. The council does provide technical assistance, and that's something that my role and NCAB are absolutely happy to help you guys figure out how to apply some of these lessons to your own CAB. So please feel free to reach out with us with any questions or support about applying the lessons in the CAB manual. And I just wanted to say thank you for joining this webinar on rejuvenating consumer leadership, unveiling the lessons from the updated Consumer Advisory Board manual produced by the Council. This webinar, as I mentioned before, will be archived on our website, www.nhchc.org, within 3 business days. A link to this archived webinar will be emailed to registrants along with the CAB manual once it's posted to our website. Questions that we weren't able to answer, if any of them come through, we'll send those along with that response. At the close of this webinar, an online survey will pop up to evaluate this webinar. It will automatically open in your browser. Please complete that so we're able to improve your experience. As we're talking about consumer advisory boards, one of the key tenets of that is being able to uplift and share your voice. So please, we would like to hear your voice on how this webinar went. So please fill out that webinar survey and then visit our website for upcoming webinars or other additional educational products. And we will now close this meeting. Thank you, everyone, so much for attending.
Okay, you're welcome. Thank you. Thank you.